Does anybody ever bite their lip underneath their mask so they don't say anything that they'll regret to a patient? It's just me. Come on. Being in the dental field, you have to be on your A game with communication. But we're all human. We say something sometimes that we didn't mean to say, and you want to crawl under a rock.
Hey, sorry, I overheard what you were saying.
Yes.
Can you give me some examples on how I can thrive communicating with patients?
Perfect example. Everybody is always listening.
Hey, Burst TV. My name is Kellee. I'm a registered dental hygienist and a proud Burst ambassador. I'm going to show you a few ways to thrive in the dental office when communicating with patients. Good communication skills is of the utmost importance. It allows them to bond with you and feel more comfortable coming into your dental office and express any concerns or issues they may have. Finding a good balance between comfortable and professional can be super tricky. However, there are certain things that you shouldn't say. Many of us, and by many of us I mean me, have learned the hard way, sadly. So let's go over a few scenarios. Picture this. You have a recare patient that just comes in with slight tooth pain, but it's not really that much of a surprise to you because you've been watching a few flossing surfaces and they're very close to becoming a cavity. Here's the kicker, you just took x-rays 6 months ago. This patient doesn't even like taking x-rays to begin with. And there's more. They have severe crowding, so you may have to take a few retakes in order to angle to open up those contacts. This is what you don't want to say. It's best if we just take quick 4 x-rays. Here we go. Beep, 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 beep. The patient heard 4 beeps thinking that everything is done. Wrong. You have to take a few more because of closed contacts. Instead, try saying this. It's best if we take a series of x-rays. This way, if you have to retake an area, you feel confident doing so and the patient gets the proper diagnosis from a great x-ray. And if you just had to take 4, awesome. Example number 2. A patient presents with a very noticeable cavity. Great. Now, as a dental hygienist, this is where I want my Oscar. Because legally, we can't diagnose decay. That's not my job, that's the dentist's job. So what did we say in school to get around this? That looks very suspicious. Suspicious? I have a huge hole in my tooth. Look, it's right here. Yeah, I am sorry that you were in pain, but once Dr. Johnny comes in, he will go over everything with you. Now, here's what is not to say because we all know there are multiple treatment options. Whoa, that is a large cavity. Dr. Johnny's probably going to pull it. And then Dr. Johnny comes in and he ends up saving the tooth and you look silly. Now picture this scenario. A young 23-year-old walks in for a comprehensive exam. You assume this is just going to be a cleaning because of her age and because she said she got her teeth cleaned around 1 year ago. We all know patients lie to us. Again, I want my Oscar. And I'm just going to throw this out there. Never assume anything. But you did, and this is what you said. We are going to get your teeth all cleaned up and you will be on your way. Except you didn't realize that she lied about getting her teeth cleaned. And you have to do a full mouth debridement and see this sweet girl a few weeks later to see how her gums are healing. Instead, with every single patient, young or old, we say, hello, welcome to our office. My name is Kellee. I'll be your registered dental hygienist today. For every new patient, we do a full oral exam first. So we may treat you with the proper procedures and care. Simple, done, no backpedaling. To finish, I'm going to give you a machine gun round of one-liners to never say. Even if you think you're being personable, it just never ends well. You look like somebody I know. Have we met before? You should get dental insurance. You should cancel your dental insurance. I'm guessing you ate garlic toast for lunch. Am I right? Am I right? Oh, are you still seeing that one person we talked about 6 months ago? This is crazy, but you know who you kind of look like when you smile? Now close on the section. This won't hurt a bit. Oh yeah, this is covered by your dental insurance. Switching sides. What to always say to your patient. Gently and slowly bite down on this x-ray tab whenever you're ready. Relax your jaw and then open so your lips and your cheeks are loose. This will help your jaw from strain and it really helps me clean more effectively. And raise your hand whenever you need me. Even though I know how most insurances work, I will print out your treatment plan at the end of the appointment and have our insurance specialist go over everything accurately with you. These are all great questions that you have about your suspicious x-ray. When Dr. Susie comes in for the exam, she will go over everything super thoroughly. But while we're waiting, I'm going to hand you this mirror and then we're going to go over 3 places where I saw bleeding. These are very common and tough areas to brush and floss. Let me show you how to angle your toothbrush. So I hope this video helped you at least think about your routine words and phrases you use in your dental office. It is difficult to switch things up because word vomit is real. It starts to become so natural for us because we do the same thing over and over again, so we tend to be repetitive with our words too. I encourage you to be mindful these next few days and analyze what you're saying. Here at Burst, we want you to thrive in the operatory. Come back every Thursday to a new video and comment down below helpful tips that you've learned in your career. We all need to hear it. See you next time, beautiful people.